These mics are on and we are recording. I'm back here giving him thumbs up.
He's thumbs up. So we'll go ahead and call our meeting to order, and we'll start off by doing the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'll go ahead with roll call.
Thank you.
Committee Member Horton.
Here.
Committee Member Grant said he would be absent. Committee Member Knowles.
Here.
Committee Member Jones. Here. Committee Member Schumacher. Vice Chair Dalton.
Here.
And Chair Ray also stated she would be absent.
Okay, starting off, I want to thank everyone for being here. And I appreciate Cicely for setting these meetings up for us and doing what you do, and Adam as well. I think it's sometimes that goes kind of hidden and unnoticed, but we do appreciate that support you give us. Okay, the first thing on the agenda is just the approval of minutes. So if someone can take a look through that and make a motion.
I'd move to approve.
Have a motion from you. Have a second?
Second.
All in favor?
Hi.
Aye. Motion's passed.
Good job, Dick.
Do we have anybody out there online checking in? Okay.
Not currently.
Well, actually, first on the agenda is this Lynn Benton Community College student, Janessa Van Epp. She got contacted with us, and we welcome you being here tonight. We're always looking for what the outside is doing. So I'll kind of let you tell us about what you're doing.
Great, thank you. I am working on a research project. My goal is to find a group like yours, smaller community groups that are doing things in their community that falls into the wide-reaching community health initiatives, the larger ones. I'm specifically choosing Healthy People 3030 because they've cut down their initiatives this year, so they're a little easier to track. So yeah, I love what you guys are doing. Bob has told me quite a bit about it. Well, in a general, I'm really interested in your health fair specifically is probably where my focus will be. Yeah, I just want to sit in, see what you guys do, see what the actual meetings and day-to-day looks like for you guys, and write about it.
So
Thank you.
Your project, can you kind of expand on that a little bit? I mean, what is it getting involved is part of that. Would you have other students involved in that process, or?
We've all been assigned kind of the vague outline for that project with a few different directions we can take it. But it really is just a research and writing project. So researching what communities in our area are doing to align themselves and to hit the goals that are kind of set forth either nationally or statewide in terms of community health.
Okay. Well, we can definitely get you signed up for the health fair next year.
Absolutely. It's funny when you
Let's
mentioned
give it
that,
to you.
it occurred to me, I was like, I could probably participate in that at some point, which is exactly what I would like to do.
Good. Yeah, and our health fair, like Dick and I and the group has been doing this for this was our 8th year this year to do that one. And we usually draw around that 350 to 400 participants in the community. I don't know, Dick, how many tables did we have this year?
40 some odd vendors.
We had 40 different.
Fantastic.
So we have a broad resource. We try to bring in a variety of. Samaritan is one of our players in that. Mental health, the housing programs, insurance, hospice. We bring it all together so people have access to it.
Yes.
I think one of our biggest additions that's really gave it a shot in the arm was we have the kids backpack program that joined us, and they usually give out between probably close to 400 backpacks that are filled with items for kids to go back to school. So that usually is the first line you see lined up. this last year, I mean, we had it indoors this year. We've had it outdoors a lot, but the weather wasn't really in our favor, so we moved it back indoors. But it's been a good event. It really has. And I think that people are getting more known about it and engaged in it, so that you see a lot of the same ones come back. But we see certain trends there too, I think. You kind of see what tables are being visited more than others, but I think definitely this year we saw a lot more people, I'd say, in towards the mental health side of it, for what I could tell.
And addictions, mental health
Yeah.
and addiction,
which are
as you would
huge.
suggest, as you suspect.
No, and that's fantastic. Yeah, reach the equitable access is such a big deal. Just getting able to reach the people that may not otherwise seek care in general is just
Well, always the challenge for us too with a health fair is it's a health fair. We don't have Disneyland rides and things like that people want to go get entertained. So that always kind of makes it a challenge for us to get that crowd increased. But it's something that we've been chipping away at it little by little, and we are always constantly looking for outside resources to come join it. I mean, we've had people that have came from Portland. I had one that came clear out of Southern Oregon one year up here just to bring their products and showcase themselves and what's available out there. So,
fantastic. How
but
do you guys usually advertise if that's not taking up too much of your time? That was one of my questions.
no, feel free. We do. I know it's on the city's web page. There's a health piece in there that you can click on. Of course, I usually send out all the applications for those that want to be there, and Dick, he tracks and puts them on the tables and assigns them. So, I mean, it's,
And many of the vendors put the flyers on their
They do that,
website,
okay.
so it kind of doubles up.
That makes sense.
and the last few years, the trend especially this year, they were calling me before I was
Yeah.
calling them.
Beautiful.
Are you doing it? Here was the application. So, yeah.
That's awesome.
And I know Dick has got a lot of good feedback from outside sources, the gravity that and impact that this committee has, that, a lot of, like I said, we're kind of unique because a lot of cities don't have health committees.
Yes,
And so it's being talked about outside, and that's kind of putting Sweet Home on the map in a sense, in a very positive way.
absolutely.
And like I said, a lot of people don't look at health committees as being a vital piece of a community, but it is. It's really tied into a lot of things. Actually, I just looked at a city that had a health committee, larger city, but I was a little bit shocked because that committee was over the Parks Board, it was over the Public Works Group, and it was a big umbrella all over these groups. I go, wow, that's different. It's not that they were running those departments, it's just they kind of encompassed those. So I'm not
Makes
saying we're moving that way, but
No, when you consider all the things that can fall into healthcare, it's not just your typical, disease prevention and scrapes and bruises. Healthcare is wide reaching.
yeah.
It's needs. It's
And as I
mental
told
health.
you earlier, if you give me your information before we leave, I'll send you the 2023 study
Perfect.
that was done here that really dug in deep into the community. So the community really spoke back as to what they felt their needs were.
Great.
So that's kind of helps direct us as well as in our initiatives. So,
Not much of a better indicator than
yeah. Yeah. So does anyone else have anything you'd like to ask this group here? Could ask the second part here. So
No, I think Janessa did a really good job of pretty much summarizing up what we are doing collectively. I mean, this is an assignment, but it's nice to see, being part of the community, that you guys have this available. I was pretty surprised when I was looking. I hadn't heard of it until we started doing this project, and I was pleasantly surprised. I know that it's a small community and it's a pretty valued on how we work together, and to have this available, and like your backpack program. I mean, what's more important than our kids? So that's great to see what you guys have to offer, and I'm really interested in learning more about what you guys have done and everything else.
How many students are in the program?
The program's split into first year and second year students. Our cohort currently has 41 or 42. We kind of lose people
Yeah.
throughout the course of the year, but presently I think we have 41.
very good.
Good size.
Well, we'll definitely exchange contact information. So,
Yes, that would
and
be
you're
great.
welcome to come to every one of these meetings if you want for a while. too.
Probably once nursing school.
All right. Anything else from you, Wanda, or anything? You have any
No.
questions? I mean, you're with the health side of it, so. Okay, the next item on the agenda is the Communication Board fundraising, and I'm sure Cicely must have something. to
I
urge that.
do, yes. So thank you again for your vote of confidence to want to support this effort. So we did go ahead and put together a GoFundMe. And then Adam was kind enough to design an advertisement. So I do have cards. So anyone that would like cards with the QR codes to pass out, you may take as many from my stack as you'd like, and we can make more if you run out. There's no timeline on this. It's really just whenever we get the funds, we'll go ahead and purchase it. And just to remind you, we are shooting for a $2,200 goal. If I'm right, 22 or 25, somewhere in there. And basically, if there are any major sponsors who are willing to commit 300 or more, we're able to add their logos to the board as well.
I appreciate that. And I definitely will want some of those cards. In fact, since we met and talked about it, I thought more of how this committee could get engaged with that. And I've already talked to a couple business owners about the idea of putting something up, maybe even a collection point at those places to where people could drop in $1 or $2 or whatever what they wanted to. I was thinking about approaching some other business owners, the idea if they would maybe take a percentage of their income that day for one day or something to put towards this project. I mean, what I've talked to, people find that they can get behind that. They understand that need. So I think that's a great connection there. And we talked about the idea of the tax receipt for people, and that comes through.
Yeah, so if they just want to contact me, I can get that set up through Cindy.
Okay.
Yeah.
Great. Yeah, I went to the website and I go, I don't see anyone's put anything in there. And that's when I got ready to hit the click button and go, nah, I need to find out some more information on this before I do
Yeah.
the click button.
And there's a note on the actual GoFundMe about that.
Cool. I appreciate that.
Mhm.
Anyone have any questions of Cicely or?
I would
Good
just,
job.
I shared it out in our safety huddle
Great.
after the meeting, and our staff were very interested and thought it was a great idea.
Fantastic.
So
Thank you for doing
I'll be
that.
glad to be able
Okay.
to share more information. At first, they're like, well, wait, how does it work? So then
Mhm.
I had to explain it to them. And then their question was, will it be in more than one place?
Well, hopefully,
Hopefully,
yes,
yeah.
that would be great.
Yeah, I think I look at 25 and I think that's a very doable number.
I agree.
All right. Thanks, Cicely. I appreciate
Mhm.
that. Okay, the next item under new business is the outreach discussion. And part of that came about previous meetings where for you, Janessa, and especially our group, this committee was trying to figure out, based on some of the feedback we got from that survey, how do we outreach into the community? And we've struggled with that for the idea of, one, trying to figure out what topic we really wanted to drill down to. What does it look like? Where do we do it? What's the audience we're trying to target? So that's always been where we've been tripping over these items for some time. The last meeting I asked, maybe we need to step back from this a little bit and maybe take it in a smaller bite-sized piece. As a committee, take it maybe to just some of our local organizations like the Rotary, because it's a good cross-section of business owners and leadership in this community, and take one of the items off that and get a guest speaker to come in and give the Rotary group. Larry is on with the Rotary, and they've been very supportive of that. So we're kind of looking at that way about this outreach program. And if any of the rest of you want to chime in up here on that one, because we've talked about mental health. If we want to go after that, we've got enough time this year to pull off a short presentation. And I think that'd be a good way to kind of kickstart and meet one of our goals, because our goal was to do some sort of outreach. In the bigger picture, we really wanted to do an outreach where we invite the community in. And again, it's like, who's the audience? How do we get them brought in? So anyone else have anything to say? Is it
Well,
just Bob? This is what we need. I need input on this
I
thing.
was just going to add, it had occurred to me that Sean Morgan, who's an outreach person from the police to basically the homeless population, but broader than that. Someone was hired to do that. I think it was hired for half time or less, and it's probably time and a half now. But it occurred to me he might, if he has not done it, invite him to the Rotary and try to kind of explain what it is that he does.
He has been
He has done it.
several times.
All right, because the other thing is they now added a second position, and it might be a good thing to have him
Right.
bring.
Did you have something to say, Wanda?
Well, I would just say I did reach out to our Zero Suicide Coordinator who's affiliated with Samaritan, and she was very excited about potentially having some kind of forum that she could present at. So she's definitely interested and would make herself available.
She could do that like next month.
Possibly. I can ask her.
What's the rest of the group day? Just start there.
Yeah, that'd be a good start.
That's a good group.
Did you reach out to
When is the meeting?
and let her know that we'd be interested in having her do that?
Here, or are you talking
No, I
Rotary?
think, well, she could come here and talk about it, but then I think we could just book it soon. I'll coordinate with Larry there to when the Rotary can do that. And then we can just put that on our agenda and knock that one out before the end of the year.
Okay.
We actually have a meeting coming up, I think, on the 28th or something like that, that we were looking for a speaker. So,
Of this month?
yes,
And-
November, actually. I'm
Oh,
sorry.
November.
So November date.
I can double check with her to make sure she's available.
Okay, just let me know and then I can coordinate with Larry and we can just kind of pull this thing all together and meet
Okay.
our outreach goal start for the year.
And her name is Catherine with a C, Rupkus, Rupkus.
And from experience, you can tell her that's basically a nice group.
Yeah, I've spoken to them before. They were pretty easy to speak with. And is it like 20-minute presentation?
15 to 20
15.
would be
Okay.
great. Some people go over, but most of the time it's 15 to 20 minutes.
Okay.
And lunch is included, our treat.
I have pretty good lunches there too.
The lunches are usually very good. I also spoke with Angie Fredericks, she's in charge of the diabetic program with Samaritan. And she said that she would be willing to come talk to this group. She'd be willing to talk to anyone that will listen to her. Very pleasant lady. She has been a confidant of mine for probably 12 to 15 years. I don't know, long time. So she's willing to come speak with us or whatever the group would like to have her do.
Awesome. I think that's a good start. And I think that falls kind of in line to, as we try to promote our health committee and what we do in our involvement and getting these guest speakers, I think it's well for us to take that, also what we learn from that, to the city council. So we bring them up to speed and have them engaged in that process as well. I think that's where we need to do, and Dick brought that up, and I'll talk about a little bit later, just the marketing of this committee and the importance of this committee. So I think that'll all fall right in line with that. So anyone else have any other questions? Well, I appreciate that, Wanda. That really is awesome that we can just move forward with something and get that going. Okay.
Give me the dates and I will also, I can just send it to Wanda
Yeah. Maybe just
Which
you
one
two,
we're
I'll
looking
step out
for.
and let you two coordinate.
Yeah.
Okay. It's your project. I love it.
Yeah.
Okay, the next item on there was expectations of the committee members. And I think in reality, the most of us, we know kind of what our expectations are, is to, show up here, be on time, inform people when we're not going to be here. But one of the reasons that got on the agenda, I met with Kelsey Ray, just to kind of talk about the agenda for this meeting, but also give her a chance to express her concerns or frustrations with us as a committee, what she sees. I mean, she's really fairly new at this position, so she's learning at a rapid rate. But I could sense a sort of frustration during some of the meetings, and that's why I approached her. What is it I can do to help support you or this committee? And the expectation is really what and I texted her again a while ago because I knew she wasn't going to be here. What is it you really want me to focus on the message you want me to give this committee? And really her focus was engagement. She feels a lot of times when she is operating a meeting, she has a comment, she's wanting feedback from the members that engaged instead of it just being quiet. She's feeling the pressure like it all lies on her to make those decisions. So
If I might, for you too,
Absolutely.
Kelsey Ray is the chair of this group. That's who we're talking about.
Okay, I thought I did read the list with it.
So I guess going forward, you know, we need to let her know that we support what she's doing and trying to accomplish, but also engage. Because there are a lot of times when meetings, we all sit here and we kind of look back and forth at one another, kind of waiting for the other. And a lot of times I will jump in and, you know, help support her, but she really encourages the rest of you to be, and the other fairly new members here is, don't be afraid to ask questions, speak up and be a part of it and just not be here. That's really what she's asking. So yeah, it's
Yeah, well, Kelsey actually brought her boss to a Rotary meeting 2 weeks ago. And so she's actually already doing what we kind of talked about.
Yeah.
So,
Mhm.
So, I mean, that's it. I think you might let Kelsey know that that's what you're going to plan on doing. I mean, that's kind of an expectation. I understand. I've run meetings before when everybody just sat there and I'm like, you must have some thoughts, you know, let me know what they are. So
Yeah.
I think we just need to support her in that and encourage each other to do that as well. And then if there's projects, I mean, Wanda, I appreciate what you did tonight, just for instance, that's a good example of what she's asking and what we're asking is each of us take something with it and just run with it. You don't necessarily need to feel you can't. So, okay, well, I appreciate that. Next on the item was city leadership meetings, and that was something I kind of just took on by myself. We have the support. I really wanted to know firsthand kind of how Cicely being in that position as part of our leadership, and Jason and Susan Coleman. So I met individually with each of those just to feel how they felt about this committee. Because one, it's kind of a new committee in their sense and understanding that health, that transition I was talking about, changing that culture a little bit to think as health as a real value to this community. And one, I can say all three of them was excited about this committee. They could see our passion about health. Again, it's trying to connect those dots. Where does it fit in? How does it work? And then I was able to see their side of what's the hurdle for them. Some of it's staffing, because when you run committees, it takes a great deal of their time getting these meetings set up, recording them, finding time in a busy schedule where they're stretched. So, I mean, I was more concerned about that. I mean, I joked with Adam, this meeting tonight would be only 30 minutes, and he was ready to put me on the books for saying that one. But I think they need to understand. And that's why I commented to Cicely and Adam. We do appreciate your work and your support, but we also need to know that we're of value to this. And I got good feedback from both Jason and Susan, and they're still trying to figure it out. They just were honest about. They saw the value, but they're still trying to connect those dots. So Dick had a very good question, was how do we market ourselves to not just the leadership? I think all three pretty much said that the city council is one that's a challenge because they're so used to budgets. They're deeply ingrained in projects, fixing roads, putting up light fixtures, traffic safety and those kinds. And I fully understand it. So health committee is kind of a new concept for them to wrap their heads on that. But I think in time, us as a committee, if our commitment is to help them understand and educate them, the more they'll embrace it. I kind of think my next step for me personally will be meeting with each individual city council members, so I can have that same discussion so they better understand where we're coming from, and I can better understand where they're coming from.
Well said.
Makes sense.
So-
They're used to doing things that you can see very clearly and tangibly serve the population at large, and it's hard to push something that's less tangible and more, you think of healthcare as something individual and it's not as wide reaching, but it is, but I can see that being an issue conveying that.
And we have to remind ourselves to be supportive of them as well. You know, I mean, we're asking a great deal from them to support us, but it goes both ways. And better to have those kind of conversations openly so we can talk about what our challenges are. And I think you'll find more and more buy-in over time with that. It takes time, you know. I mean, I remember I was the first safety director and health director for our company, and that was painful because I was looked at as the traffic cop. Boy, I was the bad guy, and it was a hard one. It took me years, but I turned it around, you know. And I was proud of the work that I did, but I also, to achieve that, I engaged the employees on the floor and gave them ownership in the program. And then I had them hooked, you know, it worked. They understood the importance of it. So, like I said, that was my experience. It was a good experience. I appreciated everyone's time and their honesty, you know. So thank you, Cicely and Jason and Susan for both take time to do that. So anybody have any other comments? I'll look right at you, Juan.
I would just add that I agree completely that it takes time to develop a new committee or a new group and find your focus and, okay, what is it that we're actually carrying out? And it takes time for people to recognize that. You know, I can say anytime I've had to introduce something new to a clinician, it's like, we're working on this. It takes a year of saying we're working on this before they even start to hear it. So it does take time. And I think the more engaged we become, and I do feel like as a committee member, I want to see us finding actionable items as well. I mean, yes, we want to be part of the overall picture of the city. And I think the way that we show our value is to also have those actions like the health fair and in other small ways as we move forward.
Yeah. And, you know, looking back, like I said, in 2023, we did the survey, and that was with the public and leadership, and they very clearly spoke what they wanted. And to me, I feel it's up to us and leadership of this to give them what they're asking for. Now, I'm not sure what it all looks like all the time. I mean, everybody has a wish list, but for us it was squeezed down to what, 7 items. And so the focus got narrowed down. So for us, it's to get creative and help the leadership, not just give it to the leadership. Here it is to do it, but we as a committee have to get that ball rolling and help that. So, and free up their time. But, and I'm sure we'll have their support going forward. So, I mean, this committee's already done some good things. I mean, we were heavily involved with the Samaritan Clinic and get that. I think that's a real shine there. And Larry's project with helping people that are displaced on the street, getting a place to sleep at night was another big project that, you know, this group was involved in. So we've got our hands in it. But again, back to Dick's point is how we market ourselves. I think that's going to be key. So
I think it's a really good idea that you're going to meet with each counselor too. Because some of the new members have no idea that this committee was instrumental in getting the homeless site up and running. It was instrumental in getting Samaritan to move here with their new, well, they're already here, but to put in their new facility. Those were major things for this community that I'm not sure that all of the counselors are aware of that. So we've made some monumental changes in this community that have been very positive.
And they've got a learning curve. They're just trying to figure out what they're supposed to be doing as
Yeah.
council members. You know.
New at this.
So I think
we can
talking
see
with them
that.
is dialogue with them is a good idea.
Yeah. I don't think any of them will be against it. I just don't know how anyone could be against a healthcare. It's just, they don't know what that's about, you know, and the relevance of it. But I think those one-on-one is another way. I would encourage all of you to do something like that. If you have a chance to meet with a counselor that, do that. You know, it doesn't take a special meeting or anything. It's just it's a phone call, you know, and just have those kinds of conversations with them. I think that'll just bridge that gap right away. So I encourage you all to get engaged like that. So anyway, I appreciate everyone's time on that one. Community food resource. I'm not sure what that one's about.
Yeah.
It's this time.
This one, just because with everything in the press about SNAP benefits likely not being available in November, the way that they have been, I know that obviously we have a food section in the community resource list, but I just wanted to ask if you guys hear of anything else that we can push out, because I am concerned about our community and food insecurity. So we'll push out what we have. But again, if you hear of anything else, please just send that my way.
I'm not for sure everybody on the committee is aware that the library, she's a Rotarian, and so she announced on Tuesday that they are accepting donations of non-perishable foods, and people can just bring them in, set them on a table. They have a table that can be put in there. Anybody that's hungry or needs something, if it's there, they are free to take it. So, you know, that's a public site that is well used by a lot of different people. And I know a lot of the homeless people spend a lot of time at the library.
Yeah.
So, you know, it's a good place to donate food. And Shim is another really good spot that is very, very active. And then the Gleaners, and
But even those groups are finding
it's hard.
to get donations. I mean,
Yeah.
I watch it on the news about every night that they're running out of food.
Well, the homeless site I know, you know, has relied on food donations through, I can't remember the name of the organization now, but it's been cut in half. So they're getting half the food they were getting last year at this time.
So it may be something, I mean, I think about the Methodist church where my wife and I go, you know, we do the meals,
The manna.
you know, we're still dedicated to doing that, but I'm sure it's going to come under crunch as well, especially around food donations. But I think that's one thing that I see there, though, for a small congregation like our church, which is a very, very small one, is the people that attend there are digging in their pockets, and if we do a food drive, they bring food, you know, and that might be something we get this one out in front of the public a little bit more, that, you know, that churches and things like that, this is an opportunity to kind of follow what your mission is, you know, to help pick up people and give. And that might be a good way. Even Samaritan or any of these groups that we can probably loop into focusing on that, you know, we might be able to push that initiative some more. So it's good.
Is the city getting a lot of feedback from the community?
I am not.
Okay.
I haven't heard anything, but again,
Nothing.
I'm always in the know of things
Yeah.
like this. I don't know how many people really are. And so my fear is that we're going to get to November and their benefits are not going to be there. And then we're going to be in crisis.
Yeah.
So I just want to make sure we have those
I'll be
resources
at your
available.
house.
Yeah, I mean, is there any other things you think we could be doing there that, I mean, in other words, we can engage these conversations, but is it something we really need to come out as a committee or something and ask the public to maybe step up?
I mean, we
Yeah.
certainly
I mean,
can.
I guess I always think of using our local newspaper, the New
Mhm.
Era, say, here's where we're at. and This
Mhm.
is our concerns.
Well, and again, if
Maybe
you,
make an invite out to these groups.
and we can do a collaboration for the free little pantry at the library. I mean, we definitely plan to push that out again, just because I know there's going to be a need.
Okay. Well, I appreciate it. Maybe we'll just do some more talking about that and exchanging some thoughts on that. I think that would
Good
be
topic for November to
Yeah.
see where we really are at that
Mhm.
point in time.
Because if there's a way, I don't know how we can measure that. But,
Well, I think just contacting Cindy Rice at
yeah,
Shim and, you know, some of the other organizations that are, you know, in the know daily, they'll tell us, you know.
okay. Well, let's keep that on our plate and have more conversations around that.
May I ask a question?
Yes.
Do you guys do much in the way of social media campaign for things like that? You have a really unique position in that you're not just a small group, you're kind of a group that encompasses the town. People may ignore things that they're not a part of, but they're all a part of the Sweet Home Health community. It reaches everyone. I don't know.
So we don't allow our citizen committees to operate their own social media under the city umbrella, but we'll just push things out through the broader, like Facebook is the big one for us and our website.
Jeff.
So, yeah.
Yeah. Thanks for the question, though.
I will go ahead and contact Cindy and just see what she thinks, you know.
Yeah.
What is she worried about? Because I'm sure she's in the know of where we are.
Well, like I said, the churches are another one that just seem to really step up at times when you ask. I know for us, the Lutheran Church and Methodist, they're kind of, and they're go-getters. They want to do a fundraiser. They've done a fundraiser. In fact, they're getting ready to do another one. It's just they do like a baked pie sale where they raise money by doing baked potatoes and a slice of pie, like $5 or something. And I'm thinking this little group of women, you know, just make it happen, you know, and then they donate those funds. So I think there's opportunities out there. So keep the ideas coming. If you hear things, let, you know, Kelsey know or myself or Cicely.
I will stay in tune with, as a rural health clinic, I'm involved with the OHA, rural health education forums, and we've had a lot of conversations about how things could change. And another thing that is possible is that people who have benefits will only be able to fill out their benefit applications online. So if they are not capable of doing that, they will suddenly be in a position where they don't have benefits. So there are some real risks coming for our community. So I'll pay attention to the food side of it as
So
well.
they have to go online. I mean, is this something that you could put out there in such a way where we had a day where there's a contact and let people know they can come here at this place and do it? I mean, it's just a
I
question.
mean, they can always use the library's
Right.
resources.
Yeah, that's exactly
Yeah.
what we were just saying.
Yeah.
You know,
Right.
She's really good.
It's just that some people, we have a lot of patients who
Yep.
can't navigate.
Is there anybody that can
computers.
maybe come from or volunteer their time to help aid people in applying applications or?
The outreach community
Yes.
is fairly strong in this area, and I know that they are aware of this. It's just everyone's taking a deep breath and waiting for November 1st to happen. They as an outreach group know what to do. It's just that there's a whole lot of folks that don't realize this is about to cave in on them. And it doesn't make any sense to go out and train them to do something that isn't a problem. Well, it makes sense to us, but it doesn't. So, yeah, it's Cicely's right. You know, November 2nd, the telephones are going to light up, and we're just going to have to be there. Wanda's right. There's a whole flock of folks that just don't know how to do this. Even you are asking questions that are a bit beyond what we normally think, how we normally think about these things. And, you know, it's no one's fault. It's just growing pains, I
So
think.
bring all your students over here.
Yeah, well,
They will have a
and
one-day sign-up time.
And that's the use of the outreach folks. They, a number of years ago, when the OHP struggle was going on, that's how everyone got signed up, and not everyone, but how people got signed up. The outreach people just took their laptops, went onto the community and found somebody on a street corner and went into churches and what can we do to help? So I think we're just about to that point again. It's just going to be November 2nd before they know where to go. It's probably more like the end of November, but and Bob's right. It could be City Hall is going to have to, you know, you got a line at your front door. You're going to have to do something.
Yeah. Okay. Well, thanks for all the input on that. And again, I think keep the dialogue open. Let Cicely know and let this committee know. And we'll go forth. I
Mhm.
mean, that's all we can do. We kind of like Dick said, we had kind of hold your breath and wait and see how it takes direct, because we just don't know for sure 100%. But
Exactly.
I'm sure there's going to be some opportunity there. So
And Cecily, I've not seen what's online. I'll check.
Okay.
But I'm involved in a couple of groups that DHS is part of.
Okay.
And they have a whole flyer thing. It's pretty in-depth.
Okay, great.
It's almost too much, but it's the kind of thing that you can whittle down to something that fits. It
Yeah.
may be something you already have, so.
No, and
I'll
so
check.
that's whatever you have, just send it to me, and I don't mind if it's redundant with what we already have. So,
I'll do that.
okay, if there's nothing else with that, I guess we're just kind of down for community business. Good for the order. Does anyone else have? Well, we got the informed and ready emergency preparedness training. What's that about?
so I'm just trying to kind of keep my ear to the ground and see what events are in the area that I think are relevant to this committee. And so this one came through from the COG. Basically, they're hosting an emergency preparedness training in November. So that's all the information's in the flyer. It's also posted with the packet online. Yeah. And it's open to anybody and it's free. So
I appreciate that. Well, and I appreciate you as what you're doing, because you're coming with a lot of ideas to us, and that's great to see that. And that's what we want. So, anybody have anything else they want to discuss? Well, Adam, I got close, but
I
not
do.
quite.
I
Oh,
was going to say,
go ahead.
Nice try.
Adam, right there. Line of step here.
Leave
Yeah,
it to
well,
Cecily to.
So I don't know if everyone here is aware, but Samaritan announced today that they are moving forward with an affiliation with Multicare. These are very high-level conversations right now, which means nothing is set in stone. We have to apply with the OHA and CMS and be approved to, this affiliation would have to be approved to go forward. We do not anticipate any issues. Multicare is a 140-year-old organization. They've been in a very good position throughout COVID. They're a Northwest located company. They have a very similar philosophy. They're mission-based and nonprofit. They have agreed to invest $700 million over the next 10 years into our healthcare organization here. So I've been in meetings all day, rearranging meetings all day, meeting with staff, rounding
Me
with
too.
people and clinicians all day long. And I would just say that our staff are hopeful. It wasn't a shock to anyone to hear this news. Healthcare, we've talked in the last few months about how healthcare is on the federal level and the state level. And while Samaritan has done a lot to move themselves into a better financial position, they're surviving and they're thriving. And thriving is what we want to do. We want to be able to expand our services, have more specialists available, improve technology, make sure we stay strong for the future. And so I just wanted to share this out with you. Best case scenario is the affiliation could be approved by the end of March. Likely it will be the end of summer, and nothing will change until probably fall of 2026. And when I say change, our name will still legally be Samaritan Health Services. That will not be changing at this time. Our insurance plans that we participate will not be changing at this time, because for 2026, those decisions have already been made. And most of 2026 will still be just going through the motions. So there is a website. It's samhealth.org/affiliation, and there will be ongoing information on that. I sent it to Cecily, and along with some other information that she can share out with all of us. But I'm happy to be available if you have questions come up. Obviously I can't speak for Marty, but these are the points that that I know to be true. And I just wanted to share it out with all of you. And again, just knowing that our staff really are hopeful and this wasn't devastating news to us. I've worked in Sweet Home and Healthcare for almost 40 years. And so I was talking with one of the VPs today, and she said, it was a little emotional for her because she's been with Samaritan for 33 years, and we've helped build this organization. And so to think of it changing is a little bit emotional. And, just in talking with staff, and I'm sure as we go through talking with our patients and community members, it's like, it's okay to feel those things. It's okay. But really the goal is that we're going to come out stronger and have more resources. So again, happy to field questions.
You know,
as you come up with them.
I'm on the IHM board, and Marty owes you a raise. That was very well done. I handed out something. It'll be in the new, all of this will be in the news.
Yeah.
It's actually started
All
already.
right.
So,
It's already hitting.
and the only addition I'd make, wanted to talk to this as a Northwest group. They come out of Tacoma, Washington. They've got 100 some odd hospitals. So this is a big group as compared to Samaritan and 5. So, I mean, it is a major step. It's one of those things where the first thing you think of is this is horrible. And then as Marty says, but the next thing you should think is, hey, this is great. That's $70 million a year.
Right.
And they have been struggling. Nonprofits, for-profits too, but nonprofits are struggling throughout the nation. So this is a solution long sought.
And they have some really strong points. They have one of the largest behavioral health
Yes, they do.
organization systems. And so we're excited about that. I think as we move forward and we learn more, I'm hopeful that there will be a lot of positives. They are also very well versed in population health, which is what we're moving to, where, really we're looking at the overall person and trying to keep people healthy. And they're very successful with that model. And so it's interesting because Samaritan was really just making a really strong move in the population health area. So, again, I'm hopeful.
Which coincidentally is what we do.
Yes.
And it's interesting that you're talking about this because I received an email from the chamber before I came here, and it was all about this. It was the announcement. So it's already out there. I kind of looked at it like, well, what is this all about? And I didn't catch it, but transitions are interesting. I went through them in my own company when another company actually took over our company, and I couldn't understand that, but how it worked, but it works through shareholders in that case. But it brought its own positives out of it. It really did. And you're talking about behavioral health. I mean, that's something we've been talking about for a very long time. And I can't see nothing but value add to that. And from the aspect of the whole health of a patient, like I said, I'm undergoing treatments right now, and I understand that whole health concept. And my doctors are frustrated with me somewhat because I push them out of the box all the time. I want to know why, and why aren't you doing this and that? And it's just simply they don't have the resources to do that. So in that case, this will probably really complement that mission part of what Samaritan's doing. So I think it'll be a good value add. So.
And honestly, we have a huge need for rheumatology, even dermatology, endocrinology.
Yeah.
The list is long in our valley that we don't have enough specialists. And so I'm very hopeful that the resources will bring more of those specialties to where we can access them.
Yeah. Well,
In a
first you get
reasonable
over the
amount of
initial
time.
shock of the announcement,
Right.
and then it
Right.
becomes
And
starting conversation.
I do want to say that Marty met with managers this morning, and then a communication went out with staff. And
9
then-
o'clock in the morning.
Right. And then it was communicated out to, more broader
Yeah.
sources of news. And then he had an employee forum this afternoon. He has a clinician forum this evening. So I think it was handled very well. It's difficult in a large organization to have information that you can't share out in advance.
It was a tough couple of hours.
Yes,
I bet
yes.
it was.
But as we move forward talking with our patients, that is what we plan to share, is that we're hopeful that things are it will be their same doctors. We are not leaving, there's no change planned for staffing. We have already went through a lot of flux in our upper level management. And so we're very lean, and I don't anticipate change in staff.
And the more you get that information out in the public, it'll kind of squish the rumors, because that's what happens a lot. Someone gets hold of something and all of a sudden it becomes the gospel out there, and it's not really true. So, I mean, that transparency and getting that information out, that's a good thing.
Yes.
It really is. So,
And I
Right.
feel like this is the time to know that, we are hearing the information as it comes forward, and that it shouldn't be perceived as negative. And it is a time when there will be those people that say, Samaritan was losing money, they're going down the drain. No, what Samaritan's doing is the same thing they've done for years. They started out as individual hospitals. There was a hospital in Lebanon and a hospital in Corvallis, and they joined together to join Lebanon and Corvallis. Then Albany came on board, and then Samaritan Medical Group was formed in the whole valley, and now we're at the coast. So I think it's just important to know that it's normal in healthcare to have change. That's one thing that if I haven't learned that, anything else in the 40 years I've been in healthcare, it's like always be ready for change.
and change is hard for some.
Yeah, it's
is.
uncomfortable for a lot of
It
people.
is.
So, well, I appreciate that one. And
Yeah.
I think it's good news. So, anybody else have anything? Going once, going twice. We'll call
Let's
this
go
meeting
home.
to it. Thank you, everyone.
Thank you.
Thank you.